Hi, my name is Ryan, student at Nightingale College, today performing the task of IV fluid and medication administration. First thing I do is I would do hand hygiene and put gloves on. Any medication we give, we're always going to go through the 6 rights of medication administration. So right patient, right medication, right route, right dose, right time, and right documentation. So for this, we were going to be giving saline and amoxicillin. See, I've done the dosage right here for the drip factor. For the saline, it's going to be 150 mLs over 60 minutes, and that comes out to a total drip factor 38 drops per minute. For the antibiotic amoxicillin, it's going to be 100 mLs over 15 minutes, and it comes out to a drip factor of 100 drops per minute. So that's what I'll be counting when I'm doing the drip chamber. Speaking of drip chamber, I will go through the parts of our IV tubing. So this is our spike end. This is the drip chamber. Got our roller clamp right here. This is the Y site and our adapter end. And on our piggyback, it's very similar. We've got our spike end, we've got our drip chamber, roller clamp. There's no Y site, but there is the adapter end, and that's going to go into the Y side of this one. So I will first take our saline. I'm going to spike it first, so I'll remove the spike. I'm going to remove the little adapter end. Move the end of this for the bag. Insert the spike end all the way in, and we'll make sure we're clamped. We're clamped right now. I'm going to hang it 30 inches above the site, the IV site of the patient, and we're going to open. Want to fill it about halfway into the drip chamber. And I'm going to open this up to get the air out of the line. We drip in our trash can right here. You don't want to do it too fast, or you can get more air bubbles. It's not going at all. There we go. All right. The line is primed. I'm going to then be counting for a full minute. It's going to be our 38 drops per minute. So I will count that in real time. Open it up. Starting now. Starting now. it. We've got 38 drops. We'll put the cap on the end here. Right there, and we'll get our piggyback ready. So it'll be the same thing for this. I'll remove the spike end. We want to make sure, check again, we've gone through our patient rights. We want to make sure our patient doesn't have any allergies. That. Insert the spike end all the way. Want to open up a little bit, just fill up the tube halfway, and then we'll start opening the roller clamp just to clear the air out of the line. I'm going to remove the cap here. Alright, clamp it, put the cap back on. I'm going to, where'd my cap go? I'm going to hold it in my hand, I'm not going to cap it. I'm going to use alcohol to clean the site of the port over here and let it dry. Throw it in our trash. After it's dried, I will then attach the IV tubing. Make sure it's above the other one. And we're going to count out the 100 drops per minute. Fastest time, and starting now. And good. Timing's good. That's 100 drops per minute. And we would cap the end. And we would clean up our mess, do a hand hygiene, document what we've done, and voila, we've done IV and medication and fluid administration.